Now, you said this is in the press release that this is the obvious step to take. So why wasn't it done before?
Well, we haven't had an air bridge to Guernsey before, to be frank. We've got much higher visitor demand going to Guernsey, and also people from Guernsey coming here. So it might not have seemed so obvious before because of the low levels of people commuting between the two islands. But now we think it's the right approach to take while the air bridge is in place.
Wouldn't that, I know you said it was slower or there were fewer people going between before, but surely that's part of the plans, making sure people, if they do fall ill, have access to free healthcare.
Well, we can't do that for everywhere in the world. Everyone has different health systems.
But we're only
and we
talking
need
about
bespoke.
Guernsey.
We are, but footfall, to be frank, between the two islands was exceptionally low. Most of it was normally business purposes, and of course companies normally carry travel insurance for their people travelling, but it's a much higher, obviously, tourist industry this time. We do need to stress, though, that this doesn't mean that people don't need travel insurance. They still do, because there are things that are not covered by the Reciprocal Health Agreement, such as should you need being brought back by air ambulance, for any form of repatriation, GP services and dental services as well. So it is important that travellers still make sure they've got appropriate health insurance in place.
So this is just emergency care, isn't it?
It is emergency care, so it is care in the emergency department and then any care that might flow off that emergency department visit. So it gives people some comfort that they will be treated without a huge bill at the end, but it is, I do stress again, important that people do continue to have travel insurance in place.
People have been travelling from the Isle of Man to Guernsey for a couple of weeks so far. Are we aware of anyone having to use the emergency department there?
Thankfully, I'm not aware of anyone having to do so, and the same here on Ireland as well, but it's a sensible precaution to have in place. I think in terms of emergency treatment, it's something that's cost neutral, with the number of visitors travelling both sides pretty even, but it's important, I think, that with this, while this air bridge is in place, that we have these kind of arrangements, and I'd like to thank my Guernsey counterparts for working with us to be able to get it into place.
So cost neutral, it hasn't cost the department anything?
So no, we won't be recharging or rebilling. That would actually probably cost more than the actual processors. So the likelihood is, with the numbers of visitors being broadly equal going both ways, that the same number of people who would require treatment here are likely to be the same. So there's no real cost involved to having this agreement in place.
There are seemingly more people going to Guernsey, though, at this point on terms of flight numbers. Are you concerned that it might be slightly one-sided?
Well, no, but also equally, I believe all the flights coming in as well to the island are pretty much booked up. So I think obviously we'll see peaks and troughs, but in terms of health, individual small numbers of disparity isn't going to make a huge difference.
What if suddenly there was an outbreak in Guernsey? Would you be concerned about the potential influx of people to our hospital healthcare services? People will be concerned about what capacity we have.
Well, it would depend about what we mean by an outbreak. So first of all, if there's someone travelling into Guernsey or a resident of Guernsey returning who are going back into self-isolation, that wouldn't be a concern. What would be a concern is obviously if either us or Guernsey saw renewed community transmission, and then as both myself and the Chief Minister have said before, we would have to review the air bridge anyway.
Mm-hmm. Well, the air bridge at the moment has been slightly extended into September. On a personal note, would you like to see that extended longer?
I think that's something to look at. Obviously, the main time people are going to want to travel is over the summer holidays while the kids are off school, and obviously at the start of September the kids will go back to school to start their new school year. So I think that is probably the ideal time, but certainly if it continues to prove popular, I think it's something that us and the Guernsey government can discuss potentially extending if we believe there's a need to do so.
When does it come into force?
So it's into force effectively now.
Right.
So both parties have basically signed up. We're doing this interview now, and then my counterparts in Guernsey are issuing it at their press conferences at 1 o'clock this afternoon.